Good afternoon, everyone. So, welcome to another live session from Let's Update Language Academy for OET Reading module. So, let's just wait for a few minutes for more people to join in, and then we'll begin the discussion shortly. This is Pooja Vijay Kumar, and I would like to welcome you all to this live session for reading discussion for Part B module. So, yes, I can see a lot of you joining in. Yes, good afternoon, Regina Shafiq, and good afternoon, Betsy Matthew, and yes, hi, Priya Ammu, and good afternoon, Danwin, and good afternoon, Karma. So, yes, good afternoon, Vishnu B. And good afternoon, Amal Kumar. And hi, Anjana. Yes. So, as you can see on the screen, I would like to give you a few instructions. First, for those of you who are attempting for the very first time, I would just like to give you an overview or introduction about the different sections and the time allotted and the type and the number of questions for the section. So as you can see on the screen, the OET reading subtest is divided into three parts or three sections. It is part A, part B, and part C. And you will have a total of 42 questions with part A consisting of 20 questions, part B consisting of 6 questions, and part C consisting of 16 questions. And you will be given a total time of 60 minutes, of which part A will be allotted 15 minutes and part B and C together will be allotted 45 minutes. And now regarding part B, as we are going to have a discussion of part B section today. So basically part B will assess your ability to identify the purpose or main idea from a short text quickly. Okay, so you need to identify the purpose. Usually the questions will be such that you need to identify the purpose or the main idea of the extract, etc. Okay, that is what you are expected to do in part B. And the text may usually consist of emails, memos, guidelines, policy documents, circulars, notifications, announcements, manuals, or internal communication. So these are the kind of extracts you can expect in part B. And regarding the number of questions or the number of texts that will be included in part B, will usually consist of 6 short texts and 6 questions following it. Okay. So, and these questions will be 3 option multiple choice in nature. Okay, so that means each question will be followed by 3 options and you have to choose the most appropriate option from among the 3 choices. Okay, so now let's look at the approach to actually crack part B. So what do you need to do first? Read the heading to understand what the text is about. Then read the question to know what information you need to find. Next, read the content of the text. Next, read the answer options. And then decide and choose the most appropriate answer. Okay, so that is the approach to actually crack part B. And yes, so there are basically there are 2 ways to go about actually solving the questions. So one is if if the answer is directly indicated, okay, so then you will be able to choose it more easily. Okay, but then there are times when it's not actually directly mentioned over there. In that cases it would be actually indirectly mentioned. Okay, so then you need to approach it differently. So that is, you should be able to choose answer easily if it is directly and specifically mentioned in the text, and in case it's not directly mentioned, you are unable to find a direct answer, then choose the elimination method. Okay, that is the method. So in that method, what you need to do is you will be able to find enough evidence to prove the other option wrong or incorrect. If you find enough evidence to prove, like if the correct answer is C, if you have enough evidence to prove A wrong and B wrong, then you will ultimately land with option C. And then you have to check whether option C is directly or indirectly implicated. The meaning of option C is whether it's actually directly or indirectly specified. Okay, so that is another approach to go about solving part. So, and then now we shall start the reading discussion of part B now. Hope you can see this clearly. Okay, so in the part B section, yeah, I'll arrange the text and the questions in such a way that you will be able to see both at the same time. This is the text 1 of part B. So usually you will have 6 different texts. So text 1 followed by a question and 3 different options, and text 2 followed by another question and 3 different options, and so on until question 6. Okay, so that is for part B. So now we shall go about solving part B questions. So yes, so the very first text is, okay, it's the heading is cost of gastroenteritis in Australia, a healthcare perspective. That is the heading. So you need to read the heading. That is important as well. Usually you tend to ignore the headings, okay, because that might be useful in some cases. Okay. So and then you can read the question to understand what you need to find. Okay, the answer to. So the question is, in which group of the Australian population is acute gastroenteritis most prevalent? That is the question, and you have 3 different options. And now you can go forward and read the text in order to find the answer to the question. So I'll give you a minute or two to read the text, and then we'll solve it together. So you can put in your choice of answers in the comment section on Facebook. Okay, so I can see your answers coming in. Sonia Baiju has responded with C, and Emily Shanvi has responded with C. Okay, so let's read this. Using 2016 prices, the estimated annual direct per capita cost of acute gastroenteritis illness was AUD dollar 14.87, equating to AUD dollar 20.27 per case. The estimated overall economic burden in Australia was AUD dollar 359 million, and the major contributors to this cost were hospital admissions, emergency department visits, and general practitioner consultations. Children under 5 years of age have the highest per capita rates of acute gastroenteritis illness. However, service utilization rates vary by age group, and both young children and older adults accounted for a substantial proportion of the overall economic burden attributable to acute gastroenteritis illness. Conclusions: although chronic disease comprise a large cost burden on the healthcare system, acute illnesses, including acute gastroenteritis illness, also impose substantial direct healthcare system costs. Providing data on current cost estimates is useful for prioritizing public health interventions, with our findings suggesting that it would be ideal if targeted interventions to reduce hospitalization rates among young children and older adults were available. So, that's the extract, and the question is, in which group of the Australian population is acute gastroenteritis most prevalent? That is a question, and the options are: A, it affects all groups equally; B, adults aged 57 or over; C, children aged 5 years or less. So yes, I can see your answers coming in. Yes, apart from the answers I've already read, yes, 𝐔𝐩𝐝𝐿 has also responded with C. Oh, I think you cannot see the yes. So I'll just think because of the banner, you cannot see the entire set of answers, right? I'll just minimize it. I hope this is visible now. Is it visible now? I hope so. Yes, now I can see answers coming in. Yes, Amal Kumar has responded with C. Priya Ammu has responded with B. Vipin Pulparamil has responded with C. Anjana MA responded with C. Joshna Jinesh responded with C. Okay, so I'll say the correct answer. It is indeed C. Children aged 5 years or less. So yes, Amalraj Binoy has also responded with C. Jesse M. Thomas has responded with C. Betsy Matthew with C also. Jinsy Pappy with C also. Yes, and let me tell you where the answer is. For those of you who have not been able to locate the answer, it's over here. Children under 5 years of age have the highest per capita rates of acute gastroenteritis illness. Which age group is the question? Okay, so I'll just highlight it. Okay, so which group is the question? See, under 5 years of age means 5 and below 5 years. Okay, so that is included when you say under 5 or under 17. Okay, like there are teams, right? Cricket teams and football teams and all such teams. So under 5 means 7, under 17 means 17 and under. So under 5 means 5 and below 5. Okay, and that is why your answer is the children aged 5 years. Okay, so now moving to the next question. and extract. Okay, it's actually the question is lengthy as well as options are lengthy also. So I'll just have to minimize a little more so that you will be able to see both. Okay, so now the heading is millions of Australians suffering from combined physical mental ill health. New report finds. Okay, so that is the extract about, and the question is, according to this report, were women with mental illness more prone to back pain, or were men with back pain more prone to mental illness? Okay, so the question is, according to this report, were women with mental illness more prone to back pain, or were men with back pain more prone to mental illness? So that is the question, and you have three different options. Okay, so now you are supposed to read the extract, and then we'll look at the questions and we'll try to solve it together. I'll just zoom it a little bit now for now, and then I'll show you the question and the option. Okay, so for those of you who have joined in late, so I'm giving time to read this extract and then answer the questions that follow. So I think all of you have read it, and then I'll just scroll up so that you can see the question and the options. Okay, so I can see answers coming in. Reshma Verghese has responded with C, Amalraj Binoy with C, Jinsi Pappy with C. Okay, so now let's read this extract first, okay, and then we'll discuss the answer. So, a report compiled by the Australian Health Policy Collaboration HPC at Victoria University found 2.5 million people are living with both mental and physical conditions. It found clear links between the two. People living with chronic physical health issues are at a higher risk of developing mental health conditions, while those suffering ill mental health were also more likely to develop physical illness. A chart showing that 28% of men with back problems and 27% of women also suffer mental health issues. It is said that combined health conditions affected welfare and education, health services and cost, productivity, employment, and social participation. Research revealed men with mental health conditions were 52% more likely to report having a circulatory system disease than the general population, while women with ill mental health were 41% more likely. Men with mental health conditions were 28% more likely to report having back pain, and women were 68% more likely. Improving the physical health of people living with mental health conditions, and conversely, the mental health of people living with physical health conditions must become a priority to improve the health of all Australians, the report said. Okay, so that was what the extract was about, and the question. According to this report, were women with mental illness more prone to back pain, or were men with back pain more prone to mental illness? Okay, so what do you think? So I can see answers coming in as Sonia Baiju has responded with B, Anshana with B. Yeah. So now let's look at this. We'll evaluate or analyze each option, and then we'll try to eliminate so that we'll reach the correct answer. So look at option A. It is more likely that a man with back pain will have a mental illness than it is for a woman with mental illness to develop back pain. So regarding a man with back pain will have a mental illness. So where is this written? Man with a back pain, I'll just highlight it, man with a back pain to have a mental illness. So where is this written? Yes, it's written over here. A chart showing that 28% of men with back problems and 27% of women also suffer, that is 27% of women with back problems as well, also suffer from mental ill issues. Okay, so that is written over here. Okay, and so a man with back pain will have a mental illness. Okay, that is around how much percent? 28%. It is indicated over here. So this is 28%, and then it is for a women with mental illness to develop back pain. Women with mental illness to develop back pain, where is that written? That's written over here. So men and women with mental health condition, for them to have a back pain, okay, how much likely it is, okay, that is mentioned over here. Okay, so now it's a comparison with both the conditions. Okay, so look at option A. It is more likely that a man with back pain will have a mental illness. That percentage is 28%, and for women with mental illness to develop back pain, how much percentage is that? It is over here. A woman with mental illness to report back pain, so that is 68%. So if you compare this, is this correct? Is option A correct? Is it more likely? No, it's 28% is less and 68% is more. So obviously this statement A is false. Okay, so now moving to option B. Okay, let's look at option B. It was more likely that a woman with mental illness would develop a back pain than it was for a man with back pain to have a mental illness. Okay, so let's see. More likely that a woman with mental illness would develop a back pain. So that is here. Okay, that is mentioned over here in the second last paragraph. I'll just indicate the percentage. That is again 68%, and a man with a back pain to have a mental illness, yes, that is mentioned in the paragraph before it. Okay, that is over here, a chart showing that 28%. Okay, so there it's mentioned. So look at this, so that percentage is 28%. So now look at whether B is correct. It was more likely that a woman with mental illness would develop a back pain. Yes, that is 68%, than it was for a man with a back pain to have mental illness, because that is only 28%. Okay, as indicated in the earlier paragraph. Okay, in the very first paragraph as indicated over here. Okay, so if you look at this, this sentence is true. Yes, 68% is in fact greater than 28%. Okay, and that is why that is true. Just highlight the answer green. Now just look whether C is correct or not. Just we are just eliminating it. Okay. So you'll just get an idea. Look at C. It is more likely that a woman with back pain will have a mental illness. That percentage is 27%, as indicated in the first paragraph where I have highlighted the text. Okay. And for a man with a mental illness to have a back pain is 28%, as indicated in the second paragraph. Okay. So is this C correct? No. It is more likely if you say that 27% is greater than 28%, it is incorrect. So that is false as well. Okay. So we have just eliminated A and C. Okay, so if possible, you can directly come to B, but for B section, I would always recommend you eliminate the other options and reach the correct answer, because that is going to give you a confirmation that it is indeed the correct answer. Okay, there are more chances because the questions are tricky, the options are tricky. There are chances that you may commit a mistake over there, so it's better you eliminate the options and reach the correct answer. Okay, so now moving on to text 3. Okay, I hope you can see this. So the heading is incontinence management using an electronic continence pad, and there is a question that follows. What is a key problem face? Yeah, the staff is facing trying to access the trying to access and manage incontinence. Okay, what is the key problem the staff is facing? That is the question. So I'll give you a minute to read the extract and then we'll solve the. Okay, so I think now we shall read this extract. Yes, so urinary incontinence is an embarrassing and disabling problem and a major determining factor for nurse home placement. It affects 2 million Australians at a cost of $1 billion per annum in residential aged care facilities. Incontinence detection and documentation and accurate assessment of avoiding patterns are necessary to implement effective best practice continence management. However, current processes are labor and time intensive. Current practice also frequently breach infection control standards for staff and threaten the dignity and privacy of the incontinent person. There is a lack of valid instrumentation to assess incontinence and monitor continence care. The Aegis continence management system comprises a sensor inserted in a pad liner which detects and monitors wetness. It then transmits the information via radio link to a nurse pager and to a tailored software application that creates continence assessment charts. The project will include um, 𝐷𝐸𝐺IS, one which is the existing prototype detecting wetness, and the 𝐸𝐺IS 2 and that monitors degree and volume of wetness, and the 𝐸𝐺IS 3 that detects chemical markers of infection or other clinical conditions. So that was what the extract was about, and the question is, what is a key problem the staff is facing to assess and manage incontinence? So and the options are: there are no effective equipment available to monitor levels of incontinence. B, radio links break, so nurses do not know a patient has pressed their call bell. C, patients always have a urinary. So these are the three options. So what do you think the answer is? Yes, I can see some of you have responded with A, and Priya Ammo has responded with A. Anjana has responded with C. And yes, more of you can put in your choice of answers in the comment section in Facebook. Okay, so the correct answer is yes, Amal Rajman has responded with C, Sonia Baiju has responded with A, Vipin Parambil has responded with A, Amal Kumar has responded with A, Litti Molchago has responded with A. Okay, so now yes, Asha Vinesh has responded with A. Okay, so I'll just highlight the correct answer, and before that I'll just yeah, Ash, yes, so yes, the correct answer is indeed A. There are no effective equipment available to monitor levels of incontinence. And I'll just locate the answer for you. For those of you who have not been able to locate the answer, it is over here. There is a lack of valid instrumentation to assess the incontinence and monitor continence. That means there is a lack. That means there is no effective equipment as of now available to monitor levels of incontinence. Okay, and that is why your answer is. So now moving on to text 4. The heading is quality of life in the elderly, health related quality of life influences the heading. That was the heading, and the question is, there are many factors that affect a person's quality of life. Which particular features of a person's life are most apparent to a physician? Okay, so yes, I'll give you a minute to read this extract and find the answers, and I'll yes, you can put in your choice of answers in the comment section. Okay, so now we'll read the extract together. Some of the factors that influence health related quality of life. I'll just zoom it a bit so that you can read it well. Okay. Some of the factors that influence health related quality of life: institutionalism, reduced life expectancy, cognitive impairment, disability, chronic pain, social isolation, functional status. Okay, may be obvious to healthcare practitioners. Practitioners may need to ask about others, especially social determinants of health, that is social, economic and political conditions that people experience from birth to death, and systems put in place to prevent illness and treat it when it occurs. Other important factors include the nature and quality of close relationships, cultural influences, religion, personal values, and previous experiences with healthcare. However, how factors affects quality of life cannot necessarily be predicted, and some factors that cannot be anticipated may have effects. Also, perspectives on quality of life can change. For example, after a stroke that caused severe disability, patients may choose treatment, example, life-saving surgery, to sustain a quality of life that they would have considered poor or even unacceptable before the stroke. And the question is, there are many factors that affect a person's quality of life. Which particular features of a person's life are most apparent to a physician? A. Friendship, spirituality, and employment history. B. Changing attitudes to quality of life, effect of a stroke and effects of surgery. C. Limited lifespan, ongoing pain, and loneliness. Okay, so these are three options. So you can put in your choice of answers in the comment section in Facebook. So what do you think the answer is? Okay, so look at this. The beginning of the paragraph. Okay, what have they said? Some of the factors that influence health related quality of life. The question is about quality of life. Okay, so they are telling that there are many factors that affect a person's quality of life, right? And which particular features is most apparent about that? Okay, to a physician. So look at this. Some of the factors that influence health related quality of life. Are example, yeah, reduce life expectancy. I'll just highlight portion. Reduced life expectancy. Look at the options and see whether this matches the option. Okay, just have to minimize a little bit more. Yeah, so look at this. Yeah, reduce life expectancy, cognitive impairment, disability, chronic pain, social isolation, functional status, and may be obvious to healthcare practitioners. Okay, that is physician. So we have got the exact sentence here. So most apparent to a physician, that means obvious to healthcare practitioner, and they are asking about the factors. Okay, okay, and just look at this. Friendship, spirituality, and employment history, is that mentioned over here? No. And yeah, not really. And look at B, changing attitudes to quality of life, effect of a stroke and effects of surgery, is that mentioned? Not exactly. And look at C, limited lifespan, ongoing pain, and loneliness. Okay, limited lifespan, yeah, that is mentioned. I'll just highlight it. Limited lifespan in the sense reduced life expectancy. Okay, and ongoing pain, yes, chronic pain, that is also mentioned. Okay, and then the next is loneliness. Loneliness is definitely mentioned. It's social isolation. Okay, so as you can see, all these three parts of options is mentioned, and that's why your answer should be option. Okay, so now moving on to text 5. Okay, so the heading is chronic kidney disease, and the question is the severity of kidney disease diagnosed by checking what? And I'll give you a minute to read this extract and answer the questions that follow. Okay, so now let's read this extract. So chronic kidney disease. Chronic kidney disease refers to all conditions of the kidney lasting at least 3 months where a person has had evidence of kidney damage or reduced kidney function regardless of the specific diagnosis of disease or condition causing the disease. Evidence of kidney damage manifests as either urinary protein or albumin, blood in the urine, or scarring detected by imaging tests. CKD is categorized into 5 stages according to the level of reduced kidney function. Evidence of kidney damage. Stages of CKD are measured by the glomerular filtration rate, which is the amount of blood the kidneys clear of waste products in 1 minute. Because this rate cannot easily be measured directly, current practice is to estimate it by applying a formula based on age, gender, and creatinine and in the blood. An individual can move up and down through the first 4 stages of severity, but once they reach stage 5, their kidney function does not usually improve. So that was what the extract was about, and the question is the severity of kidney disease is diagnosed by checking what? Option A, the amount of blood that passes through the kidneys. B, the amount of waste in the blood that is cleared by the kidneys. C, the amount of urine that passes through the kidneys. These are the 3 options. So what do you think the correct answer is? Okay, so 𝐔𝐸𝐿 has responded with B, Sonia Baiju has responded with B, Amal Kumar has responded with C. Yes, so let me tell you what the correct answer is. The correct answer is B, the amount of waste in the blood that is cleared by the kidney. Okay, and let me tell you where the answer is. For those of you who have not been able to locate the answer, it is over here. Stages of CKD are measured by the glomerular filtration rate, which is the amount of blood the kidney is clear of waste products in 1. That is how the stages of CKD are measured, or the stages or the severity of the disease is measured. Okay. So stages of CKD means the fact, definitely the severity. On the severity, it's categorized into stages, and that is measured by what? And that is option B, as mentioned in option. Okay, so now moving on to 6th question and the extract. Okay, let's just read the heading now. Memo, 𝐾𝐞𝐭 70 mg powder for concentrate for solution for infusion, and this is the extract. So after reading the extract, you can respond in the comment section in Facebook with your choice of answers. Okay, so let's read the extract. It's so Cadison Pharma has informed us that there is an error on the patient information leaflet for the above product. The error is on the portion of the leaflet which is intended for healthcare professionals in the sections providing instructions for preparation of both 70 mg per m2 and 50 mg per m2 infusion for pediatric patients greater than 3 months of age. In the incorrect version of the leaflet, the final concentration of the solution is given as 5.2 mg per ml for both dilutions. The correct final concentration is 7.2 mg per ml. However, in addition to the error on the patient information leaflet, there is also an error on the summary of product characteristics for the product. The heading for preparation of 70 mg per m2 infusion for pediatric patients greater than 3 months and the heading for preparation of the 50 mg per m2 infusion for pediatric patients greater than 3 months incorrectly state in brackets using a 50 mg vial. The headings should read as follows. Preparation of the 70 mg per m2 infusion for pediatric patients greater than 3 months of age using a 70 mg vial, and preparation of the 50 mg per m2 infusion for pediatric patients greater than 3 months of age using a 70 mg vial. Steps have already been taken to correct the errors on both the patient information leaflet and the summary of product characteristics. Please note the patient information leaflet and summary of product characteristics for the 50 mg presentation of the product are correct. So that was what the extract was about. So moving towards the question, what is the issue being raised in the memo? And the options are A, there are errors in one part of the patient information leaflet. B, there are errors in 2 parts of the patient information leaflet. C, there are errors in 3 parts of the patient information. Okay, so what do you think the answer is? Okay, so as mentioned in the paragraph, I'll just highlight the portion which is likely to be the answer. That is the error. They are talking about the errors, right? The issue being raised in the memo. So the issue is that there are errors in the patient information leaflet and on the product summary of product characteristics area for the product. Okay, so in the patient information leaflet, where are the errors? One is in the section providing providing instructions for preparation of both 70 mg per m2, and there is another error in the 50 mg per m2 infusion for pediatric babies greater than 3 months of age. So there are errors in two parts in the patient information leaflet, and there is also another error in another part, that is in the summary of product characteristics for the product area also, that is, but not in the patient information. In the patient information leaflet, there are errors in two areas. One is in the preparation of the 70 mg per m2, and the other is in the 50 mg per m2 area. There are two errors. That is why in the patient information leaflet alone, and that is why the answer is there are errors in two parts of the patient information leaflet, that is option B. So I hope this is clear to you, and I hope this session was useful to you. So it's time to wind up actually, and so see you next week. So thank you for joining us, and wishing you all a very happy and prosperous wish. Thank you.